Good results from shoulder and knee reconstruction are 50% surgery and 50% rehab. And in a lot of ways, the surgery is the easy bit. It's what comes after that's the hard slog. Lots of people come to their post-op clinic and sometimes it's a bit of a confessional session. Dr. Colvin, I'm sorry I haven't done as much rehab as I should have. And look, we're all working people, we've got families, we've got children, we've got work, we've got holidays, travel, and we have to think about what's achievable. Only a professional athlete has all day, every day to work on their rehab. So what I want to get across is what's the critical part of your rehab and what's the ideal or perfect rehab. And when it comes to rehab, I think about it in two concepts. The first is stretching, where an external force moves your joint, and the second is strengthening, where you move that joint with your own muscles. So early on, we have to protect the reconstruction. We don't want to do any damage, so the strength work has to take back seat for a little bit. But what we are onto straight away is the stretching part of it. And if we're off to a slow start with the stretching, then scar tissue forms, muscles shorten, muscles waste away. So you'll find that we're right from day one getting onto that stretching. So I've put together some very detailed programs that take you step by step through your recovery from shoulder and knee reconstruction surgery. I call them CORE, short for Colvin Rehab, and they are the core of your rehabilitation plan, your recovery process, to get the absolutely best result from your surgery.